I am Dr. Gautam Swaroop, Director Cardiac Sciences, Tender Palm Super Specialty Hospital. There are certain patients in which we are encountering the problem that the angiography has been done and patient turned out to be the triple vessel disease or complex coronary artery disease. In certain subset of the patient in which we are find that in these patients we can't do bypass surgery because of the high risk, especially if the ejection fraction or pumping capacity of the heart is very low, in which we find that the surgeon is basically worried about the outcomes and they tagged as the very high risk bypass surgery. Most of the patients are octogenarians in the 70s, in the 80s, in which we generally face these kind of the problem. After the major heart attack, heart pump becomes weak and angiography has been done and patient turned out with the triple vessel disease. So in these subset of the patient, there is a new innovation that is known as the Impella. Impella is the world minimum or miniatures external heart pump. It is a kind of the heart pump in which we can place this heart pump into the main chamber of the heart that is known as the left ventricle. When it goes into the left ventricle, it increases the cardiac output or increases the ejection fraction or pumping capacity of the heart, during which we can do the various high risk intervention in that subset of the patient, because Impella take care of the heart and it brings the heart to the normal ejection fraction. So during the procedure, Impella protect the heart and we can do any kind of the complex coronary intervention and we can prevent the bypass in certain high risk patient, in older age patient. So if you ask that our best safety device in which we can do the high risk coronary intervention, especially if the pumping capacity of the patient is low, so the answer is Impella. By putting Impella, we can do the complex high risk intervention, especially if the pumping capacity is low. We have done maximum number of the Impella in the Uttar Pradesh in this hospital, and we are offering this cutting edge technology to the various patients. Thank you.